Pathology Department, and today we're sharing some facts about sepsis. So, what is sepsis? It's a complication caused by the body's overwhelming and life-threatening response to an infection, which can lead to tissue damage, organ failure, and the ultimate it will cause death. And it is the number one leading cause of death in the United States, causing over 258,000 deaths a year. So, what causes sepsis? Infection. And what is infection? It's when germs enter a person's body and multiply, causing illness, organ and tissue damage. So some of the common symptoms: shivering, fever, or if you're very cold. If you have extreme pain or discomfort, and if you have like a clammy or sweaty skin, confusion, disorientation, and short of breath, and elevated heart rate. How is it treated? The doctors try to treat the infection because that's the source of sepsis. Keep the vital organs working and prevent a drop in blood pressure. That's the key to take the blood pressure, to put the blood pressure at the normal level. And then antibiotics are given. These are the early interventions. Whenever the person, they are diagnosed with sepsis, these are some of the early interventions we have to take in order to prevent further damage. IV fluids, and then maintaining blood pressure. And sometimes when sepsis gets worse, some of the organs, we have to remove the tissues are damaged, and the only way we can prevent or we can save patient's life is by removing the damaged tissue due to infection. Does it have a long-term effect? Most people recover completely with early identification. That's why we push for early recognition and our 3-hour bundles. So that's what we've been pushing it out, and it's in our hospital and in nationwide too. So that permanent damage to organ may occur, but that is if we don't detect, if the sepsis has gone worse. So if it's diagnosed early, treated well, it shouldn't go that far. And sepsis, if untreated, leads to death. And these are some of the guidelines that was in CDC. I got that slide from CDC, what's some of the preventative measures that we could take to prevent sepsis. These are you can get vaccinated against flu, pneumonia, or any other infections that could lead to sepsis. And prevent infections. How can you prevent it? Of course, cleaning and hand hygiene is the key. Know that time matters. If you have a severe infection, look for signs like shivering, fever, and those common signs that I talked about in the earlier slide, where if you feel very cold or if you have extreme pain or discomfort, and then you just go see your doctor if you see those symptoms. What's the national and worldwide goal, including our hospital's goal, is to increase awareness and increase, we do that with our education, and we push, our key is early recognition. We want to recognize sepsis as early as possible so we can treat our patients. And who is it for? It's for everyone, including general public, our patients, family members. How can you know, or how can you increase awareness? You just simply ask. You can ask your coworker, you can ask your doctor, you can ask nurses, and then just continue to increase knowledge about sepsis and help spread the word. The more knowledge is, you acquire more knowledge when you share it more. And advocate for yourself and others. And you are the key. You are important part in your care. That's your role. Do you want to take it? Sure.
All right, so we have the sepsis measure that was put into place last October. And the purpose of that is to help monitor what we're doing in compliance, because this 3-hour bundle and the other things that we're doing, the whole goal of that is to help decrease mortality from sepsis. And we're going to show you, we've done a really good job here. So as you can see with the 3-hour bundle, one of the things, of course, is early recognition, just like Cal said, and we have to start doing some interventions. One of the main things to do is to get a lactate level. So if your initial lactate is over 2, we have to get another lactate within 6 hours. You can do it in 4 hours or 5 hours, but within 6 hours to see if our fluid doses that we've given have made any impact on the patients. We do blood cultures to see what's going on with the patients, and then we also give antibiotics, and there are several approved antibiotics, and they're IV only for this. Now later on, the blood cultures come back, we have specific organisms, we may have to change the antibiotics, that's okay. But we start off with this list of approved antibiotics, and again, it's IV. So the whole goal is early recognition. We want to do early treatment and intervention because sepsis has a whole spectrum. You have sepsis, you have severe sepsis, you have septic shock, which can lead to death. And so just like most things, the earlier you intervene in that process, the better the outcome. So if we can catch somebody when they have an early infection, we can catch them when they just have sepsis before they become severe or go into shock, the better the outcome is going to be for them. So this is outcomes that we've done here at Memorial Hospital. We had sepsis early recognition. When we first started this last October, the education department worked really hard. We did education for folks, and we did a little evaluation. And 44% of the folks here could recognize that. After the education, we had 75% of the folks could recognize these early signs and symptoms. That's really good. And that's from all over the hospital. You know, some of us are nurses, some of us work in the lab, some of us work here. Today we just had someone from dietary who came and they wanted to get some handouts, some more information about it. That is fabulous. So our sepsis mortality rate here at Memorial Hospital also dropped. So our baseline numbers were from June 2015, and we had 14.89% mortality rate. Now, nationally, with sepsis, severe sepsis, septic shock, it could be 25 to 50% is the mortality rate. So ours wasn't too bad to begin with. But now that we did Q2, so that's June of 2016, our mortality rate here has dropped down to 1.56%. Isn't that incredible? Yay! It's great. So this stuff works. So when people are like, oh, you have to do this, or, you know, we need to see this, this is why. Because this is the kind of outcome. And not only do you want that for your patients, but what if this is you, or a family member, or a friend? You certainly want them to get the best care possible and have the best possible outcome. So I think that's just wonderful. So sepsis is a big problem, and it's never going to go away, but we can help combat it, and we can help improve the outcomes, and that's what our goal is. Okay, so these are some of the screening tools and part of the bundles and things that we use. So here, we went ahead and modified things, and this included so many folks from all the different areas. I'm sorry?
The door's open.
Yeah.
And we had lab involved, all these other folks involved, so we could have as smooth a workflow as possible. And here, that's not easy, as all of you know, because we have different electronic health records, different systems, and they don't talk to each other. So guess who it's up to? It's up to the humans to talk to each other and make sure these things get done, and the tests get done, and so on. So we have these order sets, we have these screening tools, and by the way, all these things we're talking about are for adults. There's a different thing for pediatrics, and some things don't work as well for pediatrics. For example, lactate level. It's not the same in kids, so don't even think that for kids. So we're focusing on adults with this. We go ahead and adjust the protocol to patient condition. For example, we have to give a lot of fluids, and the fluids we give are based on the patient's weight, 30 milliliters per kilogram of weight. So that could be a pretty hefty amount of fluid, 1,500 up to even 3,000 liters. So that's a lot to give. And by the way, you do give that. Even if patients have a condition like congestive heart failure or kidney disease or whatever, if they've got sepsis, they're going to die within hours. So you want to give them all this fluid, then we'll take care of the fluid overload later once they're stabilized from the sepsis. We keep meeting. We are doing bi-monthly, sorry. to just see what's going on. We've tweaked a few things along the way, but now things seem to be working really well. And of course, so many folks are involved with that. Physicians, nursing, lab, all these folks are involved with that, and it's really important that we continue to do this. We want to educate all the employees on sepsis. Like I said, we had folks from areas maybe you're not even thinking about. So we want to keep up the fact that we're all thinking about it. But it's important for all of us to spread the word, just like Cal said. So when you're talking to your patients and their family, spread the word. Do you know 80% of the people with sepsis could have been seen in the clinic, and they're spotted with that because they have chronic conditions like congestive heart failure, whatever, and they start to see some of that then, but we're not recognizing it there. So that's our next step is to, okay, we're seeing it inpatient, we're taking care of it here when they come in through the emergency room and they get admitted. But if they just saw their physician yesterday and they have a history of CHF, who's looking at that? What about COPD? And they got pneumonia, or the beginnings of pneumonia. Some of the main areas we see for these infections that lead to sepsis have to do with things like the lungs. So respiratory, you got COPD and you're prone to pneumonia. Skin, so you get cuts, scrapes, that kind of thing. Gut, so your GI tract. So there's these areas that you're looking for that are going to create a possibility of multiple infections or ongoing infections. So if you have a chronic illness, or your family member does, or you're seeing a patient with that, it's really important that they take care of themselves so they can cut down on those infections which can lead to sepsis. All right, guess what? So, we're going to switch into teams. How many teams do you think we should have? 4? We have 4? Okay. You guys be a team. You guys be a team.
Is this the cow?
You guys can be a team. Or even come down over here.
Stephanie. You're going to know all the answers. Amanda's like, here, we'll give Amanda the buzzer. I just wanted to be first.
All right,
Yeah.
Oh, yeah.
You're the only one that knows.
All right. Test your buzzers, make sure they all work. Okay.
Good experience for the student.
Lisa, come on over. Are we ready?
Just bring it
Yeah,
up.
come on, Lisa.
Sure.
Yes.
Sure.
So, which team are you? What's your buzzer?
We're the cow.
Okay, now.
Take one of the chairs and go, or you can go on the other side even with the chair.
Duck.
And your
You
buzzer's
don't get that involved.
And you can whisper her, and you can whisper
Horse. Okay, and yours is? So those are your team names, huh? Now, do I have to run this off the computer?
Probably.
You guys sound a bit better there.
Well, I mean, I could be, but I would be with no help. Oh, you don't want to be on the team, I see.
Not me. Okay,
We'll share.
page number from 1 to 4.
That's what he said.
4. Okay, pick a number from 1 to 4.
2.
Your? Pick a number from 1 to 4.
3.
And over there?
Does it need to be different? Same. 4.
Go ahead.
I guess we're 1.
3. Okay, you're gonna go first.
Oh,
So. It's hard. Go first.
We're going to go for the duck.
Okay.
No, we can't.
Look at this. Okay, now don't forget in Jeopardy, we're giving you the answers and you have to have your reply in the form of a question. I will also tell you, unlike regular Jeopardy, we do have a lot of true and false. So, when we have the question, you guys will ring in with your buzzer and you'll be the ones to answer. And don't forget, if it is something like true or false, you still have to say like what is true, what is false. Are you ready? Okay, so, was what, septic shock for 50 points? Is that what I heard?
Yep, 50 points.
When hypotension persists following fluid resuscitation.
What is septic shock?
Whoops, I'm not doing it. When are vasopressors administered to a patient with septic shock? That's the answer we were looking for. What?
Are you gonna keep track? Are you gonna?
Yeah, she's got it.
So that would be.
Don't we get to pick our own question, Jeff?
Yeah, they're negative. That looks like another question.
But not us then.
Don't forget, Jeopardy is you answer in the form of a question. So the answer was, when are vasopressors administered to a patient with septic shock? When the hypotension persists even after fluid resuscitation. Tricky.
So why is it
huh?
listed as a
Tricky.
question again?
This is
That's
your
the
answer, which
answer.
is always the Jeopardy question.
So
It's
what was the
confusion.
question?
Negative.
It looks like it was a question.
What was the answer?
My
Go
answer
back
was
and figure it out.
Yeah.
Oh. So, yeah, I was gonna say that's the
When to give
definition of
vasopressors, when hypotension persists.
Okay?
Oh, that's tricky.
These are.
That's why it was
Yeah.
50 points, that was a hard one.
Okay, so we need to go back to Christy's team because she's the one who had the last selection.
All right, let's try
This
to
is
easy
answer.
one then. 10 points for sepsis, 10 points.
I'm gonna go easier, huh?
Yeah, we'll see about that.
Oh. How many people die per year from sepsis?
Yes! All right, so you get to choose the next one.
Okay, Natalie, it's your turn.
Severe sepsis for 20
Okay.
points. Don't all ring your buzzers at once.
Yeah, exactly. Go ahead.
I feel like, how many people die each day from sepsis?
Very good.
That one goes to
Gosh,
the,
really good, yeah.
what are you guys, a cow?
Goes to the cow.
It was the cow.
Okay, the cow gets those points, so cow gets to choose
20
again.
points.
You guys choose.
All right, Amanda.
Let's go.
Yeah.
Severe sepsis for 10.
What are the symptoms of sepsis? Signs and symptoms.
Oh, yes, all right.
All right, you get to choose the next category, next question.
Septic shock for 10 points.
Woo! We didn't talk about this. See if you can get it anyway.
We want.
Isn't that the, that's the answer,
That's
right?
the answer.
What's the answer?
No.
No.
Because it's a question, we're supposed to say the question.
Yeah.
Yeah, but it's.
Give her a break. Give her a break, she says.
What increased mortality?
Okay, nobody have an idea?
Hand washing,
Oh, okay.
not hand washing.
No.
I guess delayed, what is delayed identification? Yeah, early recognition.
Oh, yeah.
All right, so who's gonna pick the next one?
So the
Rooster
rooster.
Rooster team, yes.
Horses, horse, this is a horse.
I love the roosters.
Yeah.
Septic shock for 20.
Answer true.
All right.
Okay, we're gonna do potpourri for 10.
Potpourri.
Yeah.
Oh, I think maybe first.
That was.
I think you did.
We didn't.
What is important for treating sepsis and lowering mortality rates?
I think we should take it
Sepsis.
as Way to go, way to go. Okay, let's pick your next question.
Oh, sorry, the bundle one for 10. Sepsis, severe sepsis bundle?
What is to lower mortality from sepsis?
Okay, I was wrong, sorry.
It's okay.
It was 10 points.
I didn't hear any other animals out there in the.
Nobody
A
else
bunch of chickens out here.
Who selects the question?
Oh, severe sepsis bundle for 20. True. Oh wait, sorry.
Oh,
Oh yeah, I was wrong.
Oh, was that in the form of a question?
No, it was them anyway.
What is false?
Yes. That's true.
Okay, next question.
Septic shock for 30.
Hold it now. What is false?
Should be
30 mils per kilo.
Very good.
Yes.
Boy, you can't
Big
break
point.
stuff this group, can you? All right.
What do you guys want? Potpourri for 20. What is the 3-hour bundle? Interventions?
I think we should take
Yeah,
that.
because it really is, but.
Accepted.
Okay.
What, you guys use again? Good question.
Severe sepsis bundle for 30.
Who was it? Who was it?
Horse?
That's what I thought.
Okay.
Okay. False. What is false?
Yay!
Boy, this is a tough crowd. You can't stump them. This is great. Okay.
Septic shock for 40.
Whoa.
Yeah.
What is false?
Good job.
That's what you get for
Anna's doing it.
That's what you get back for hanging out with Kathy.
I'd like to point out Anne is not a nurse. See? She just asked to eat lunch with me and hear about sepsis. All right, next question.
Oh, let's go potpourri for 30.
This is going to be tough for you guys because we didn't really talk about it, but take a stab at it. And then let's
What
look
is
over
an
it.
either or question? I should know that. I know, I should too. I was like, I know.
Some kind of statistic that we've been.
Let's just go ahead and move on to that.
Currently.
Oh.
Okay. Oh, okay.
Oh.
All right, so go ahead and select another one.
Let's go sepsis for 40.
Like, I was, what is shock?
Yeah.
Septic shock.
They're all big numbers.
Etiology, okay.
All right, so pick a number.
That's me?
I think so, yeah.
Okay, let's go severe sepsis for 30.
Sorry, question. What is the national mortality rate? Boom.
Yeah.
Man, you guys
Whoa.
got it now. I was gonna say it, I was like, oh, maybe it's not right.
Okay.
Can't go wrong here. How about sepsis for 20 points?
Yeah, let's see what I can do.
Oh, you're all this butter going on.
That would be what is true. Yeah.
Like a second that.
Okay, sepsis for 30.
That feels good for like my OCD part.
That's good. You said it.
I said, what is true?
Ah.
All right.
Severe sepsis for 40.
Should I just hit it right now?
Oh.
Take a shot at this. And again, we won't subtract points because we didn't say.
Okay, I'll take a shot. 7 out of 10.
Whoa! Wow, that is terrific.
We should do the lottery too.
I should just said it with confidence, and after being like, oh, it's good. Oh, so let's do the bundle for 40. Severe sepsis bundle. Okay. What is true? Is this a true false thing?
No.
Oh. They are.
We're looking at lactate, we're looking at fluids, we're looking at cultures, we're looking at antibiotics, that's okay? All right.
It's hard to know if it's really true false.
What's the difference between the 3-hour bundle and the 4 bundle?
I don't know who's supposed to pick what.
Sorry,
supposed
this
to
is
pick
like
it.
just an education question, I'm not keeping up. What's the difference between the 3-hour bundle and the 4?
It's a 6 hour. That was the 4 things to do, but it's a 6 hour and 3 hours.
6 hour.
Okay.
And I have some cards for you to hand out, and I have some cards to hand out to you at the end, for those of you who don't have it. And we'll also have a little testimonial to read before we leave. So let's go ahead and
Okay.
finish up the game. Whose turn is it to pick a question?
Potpourri for 40. What are places you can get more information on sepsis?
You're good.
All right.
I know, I was like,
I broke it with my internet. Sepsis for 50.
She broke the button?
Yeah.
Oh, no.
Or the batteries or
So what you're gonna have to do is make your own noise.
yeah, exactly.
Okay.
We're dogs, that's right.
Sepsis for 50?
What are 4 areas where sepsis can start?
All right. We're getting down to the wire here.
Let's do potpourri for 50.
Beep. What are things we can do to prevent sepsis and mortality in our hospital?
Yeah.
It's nice when the answers are given.
I don't know what I did.
Maybe that was supposed to be the last question.
I don't have that anymore. Oh, nobody, that's right.
Well, I mean, there's 2 more.
Okay,
right?
here we go.
I mean, maybe I was-
So, you guys pick.
Oh,
Your
again,
turn.
severe sepsis for 50.
It would be the national and the worldwide goal of sepsis prevention and bundles.
Yeah, exactly.
All right, and the last question, are we ready?
Yeah.
What is true?
Would you say that was her patient today? Oh, yeah?
Doesn't have it loaded.
Okay, are we ready for final Jeopardy?
Make our
Oh,
way.
Yeah.
Get it all?
Oh, we're all gonna do it. Yeah, exactly. Final Jeopardy for.
Okay, you ready? Fingers on the buzzers.
Oh, Wallers.
What is Memorial Hospital's decrease in sepsis mortality?
Oh, that's pretty impressive.
They were supposed to do waivers for that last one. So that's
We bet it all.
bet it
I think
all.
everybody bet it all.
Yeah.
Go for it.
I guess, yeah, we
Just double.
Well, just so you know, we're all winners when it comes to sepsis.
I know,
So I'm going to pass these around for those of you who don't have these on your cards already, and there's 2, because they all wouldn't fit on one card, so take one of each and put it on your badges. I'd also like to thank Anne Theodore, because we've had these posters up all around the hospital, And September is Sepsis Awareness Month, and you can see we have our ribbons, and Ann made the ribbons for us, so thank you very much, Ann, I really appreciate it. Aren't you all jealous? And then we have some testimonies here from folks who have been touched by sepsis. Care which one? I'll do this. Okay. Discharge Teaching Alerts Family, patient testimonial by Butchie and Dave Lind, and they live in Alaska. By the way, these testimonies came from the HRED Hen 2.0 website, and they are funded by a grant, and they cooperate with the American Hospital Association. They have all these different tools and resources we could use. And they got some of these testimonies and published them, and I found them. We have several more, and you can go on their website if you'd like to read them. Some are quite touching. So in 2012, my husband underwent a routine biopsy for prostate cancer. The urologist told us the chances of developing sepsis after the procedure was 1%. He gave us the sepsis symptoms and warning signs. Well, my husband was part of that 1%. I was glad I was there when the doctor went over the symptoms, as I recognized them quickly: fever, chills, and denial that he was just getting sick. We are from a small rural community where there is a small hospital that only does emergency care / family medicine. I brought him there immediately. None of the antibiotics worked. He needed a special kind that was not readily available in our rural hospital. He was medically evacuated via Learjet to the big regional Alaskan Native Medical Center, where they did have the antibiotic that they needed to get rid of the stubborn strain of bacteria, and he was very ill. That antibiotic saved his life, and my husband says that I, his wife, was his strongest advocate, and without my insistence that he get checked, he may have ignored the symptoms until it was too late. We are thankful he is okay, and this all happened within a matter of 72 hours.
So I have another testimonial from Jamie L. Smith, and she's from Kentucky. Quick action saves lives. On August 9th, I developed a kidney stone. I knew what it was because I have had them before. My husband took me to the emergency room, and my urologist scheduled my surgery for the next day. They gave me pain medicine and sent me home. The next day, I returned to the hospital. However, I was now running a fever of 102 degrees. The nurses and doctors recognized that my body was turning septic. They put a stent in me and removed what infection they could. I was placed in ICU for 3 days, where I was given antibiotics and fluids. I thank God that the nurses and doctors could recognize what was happening. They said if I arrived 12 hours later, I would have died. So that's just the importance of early recognition and treatment.
Do you have any questions, comments, observations? No?
Thoughts?
Well, thank you all, and thank you all for all the good work that you do. You know, everywhere in this hospital, we have housekeeping who's involved with this, like I said, lab, everybody in the hospital helps contribute to this. And if you see something, please speak up and remind people, are we thinking about sepsis? Talk about it with your family members. You know, do you see this, what's going on with them? And then also outpatients. You know, spread that word. As we said, 80% of the folks are seen in these clinics, and then right before they develop full-blown sepsis. And we can catch some of that early. And treatment is just so important. Early treatment is so important, as we said. It's just as important as recognizing a stroke or a heart attack. The earlier you intervene, the better the outcome. So thank you all for coming. We're at the end of our time. We really appreciate it. Thank you.